Yo, go, go, go. Hustle hard, hustle every single day. I'll be making moves till I'm buried in my grave. To the system, I don't wanna be a slave. I've been doing shit my way, or the highway.
The deepest contradiction in black life, as Dr. Hendrik Clark taught us, is the expectation that the oppressor will ever participate in your liberation. For over 300 years, black labor built the foundation of American capitalism, brick by brick, coin by coin, body by body. And yet the system that our labor created was never designed to return freedom, wealth, or dignity to the people who built it. Every gain we've wrestled from this system, civil rights, voting rights, anti-discrimination laws, desegregation, came only through struggle, sacrifice, and blood. And even then what we are offered are concessions, not justice. Crumbs, not liberation. Temporary relief, not structural power. This contradiction is precisely why the Black Infrastructure Trust must exist. BIT begins with a fundamental truth that our ancestors understood intuitively. The oppressor will never dismantle the structures they depend on to exploit you. They will reform them, rename them, repaint them, modernize them, but never surrender them. So instead of waiting for permission, begging for inclusion, or hoping that the same institutions that profit from our suffering will one day choose to relieve it, BIT empowers Black communities to build our own infrastructure, with our labor, our capital, our knowledge, and our vision at the center. Housing that doesn't depend on predatory landlords. Child care that doesn't collapse under market prices. Health care that isn't a revenue stream for corporations. Economic systems that circulate wealth within the community instead of extracting it. BIT is not charity. It is not reform. It is not integration into a violent economic order. BIT is a blueprint for self-determined liberation, the kind rooted in ownership, governance, and collective power. Because liberation cannot come from those who profit from your oppression. It can only come from us, the descendants of those who built this nation and who are now building the future our ancestors were denied.
Ready to get in? All right. Good morning, everybody. And first, I want to thank Senator Klobuchar. She put this great event together, and she's been one of the greatest leaders, not only in the Senate, but in the country, on health care, on extending the ACA tax credits, and in reducing costs for the American people. Now, tomorrow is a moment of truth for the Republicans here in the Senate. Are they going to bring health care costs down, or will they sit by and let premiums explode for millions of Americans? This vote is going to be one of the most important votes that they take in the whole term of the Senate, in the whole 2 years of the Senate. We have only 3 weeks away from massive and devastating cliff for millions of Americans. As you will hear from some of our guests here, this is not just sort of an on-paper accounting political thing. This is life and death for people. This is having a decent life or a life where you can hardly cope if you don't get the health care that you need. Congress should have solved this problem months ago. Hakeem Jeffries and I asked the Republican leadership and Donald Trump over and over and over again to sit down and come up with a solution to the crisis. They refused. We were ready. We said, let's negotiate. Let's find a path. Republicans refused to lift a finger. They knew the crisis was coming. But ever since the fight with Hillary Clinton on health care in 1993, the Republican Party has been just intransigent in not helping people, but just helping the special interests, whether it be the drug companies or the insurance companies or hedge funds or whatever else. They just sat there, did nothing. And now the day of reckoning is coming. And it's the day of reckoning for millions of Americans who are going to lose their health care, who are going to have to pay $500 or $1,000. A working family making, say, $60,000, they think they're in decent shape in most parts of the country. But how are they going to afford an additional $10,000 a year? What are they going to cut back on? Their health care, or their food, or their ability to buy some Christmas presents for their kids? So, with just days left on the clock, the clearest, cleanest, easiest, and best path left is to bill what Democrats are proposing. A clean extension of current tax credits. That's it. No poison pills, no gimmicks, just relief.
Why Republicans let ACA subsidies expire. And here's the part the public is never supposed to understand. Letting these ACA subsidies expire isn't a policy accident, it's an economic strategy. When healthcare becomes unaffordable, people don't simply stop needing care. They fall into the most profitable parts of the American medical system. Emergency rooms, medical debt, charity care write-offs, and predatory financing. All of those are revenue streams. For private insurers, the calculus is simple. ACA subsidies keep healthier, lower-cost people in the insurance pool. When subsidies expire, those people drop coverage. What's left in the pool are older, sicker, and more expensive patients. Insurers then justify massive premium hikes while maintaining profit margins. Wall Street likes that. Hospital conglomerates like that. Private equity-owned provider networks like that. It is a predictable cost-shifting cycle that extracts billions from working families and transfers it upward. Second, Republicans have built an economic ideology and donor network on the idea that public goods must fail so privatization becomes the only option. If the public healthcare marketplace appears expensive, crisis-ridden, or unstable, it strengthens their long-term goal, funneling people into high-deductible plans, unregulated short-term junk plans, and employer-based systems that keep workers too tied to their jobs to negotiate better wages. Third, letting subsidies lapse is a backdoor tax increase on working families, but one targeted enough to avoid political blowback. The families paying $400 to $600 more per month are not Republican megadonors. They are teachers, nurses, retail managers, mid-level professionals, and small business employees, people whose economic pain doesn't register in a party funded by corporations whose profits rise when payroll costs stay low. And finally, there's a brutally simple financial truth. Uninsured people are more vulnerable, more economically fragile, and more easily exploited. A population crushed by medical debt is a population with less political power, less mobility, and less capacity to organize. Political elites understand this. A destabilized working class benefits those who already own everything. So when Republicans allow the ACA tax credits to expire, it isn't fiscal discipline. It isn't about deficits. It's about maintaining a system where the suffering of millions is a revenue stream, and where the instability created by that suffering keeps power exactly where it is. But here's the part that matters most. It doesn't have to be this way. Not for that mother choosing between healthcare and her retirement. Not for the families being pushed into junk plans. Not for the millions of Americans forced to live at the mercy of a market designed to exploit their vulnerability. Because the truth is, skyrocketing premiums, medical debt, and catastrophic plans aren't failures of the system. They're the business model of the system. And any system built on extracting profit from human suffering will never produce health, only wealth for the few. That is precisely why we built BIT, the Black Infrastructure Trust, and why its healthcare model represents the first serious departure from the exploitative, scarcity-driven logic that governs American medicine today. 1. BIT's healthcare model starts with a simple premise. Care is infrastructure. Asterisk asterisk. You cannot have a stable economy, a stable family, or a stable community without access to reliable, affordable healthcare. Roads, power grids, water systems. We treat them as essential infrastructure because society collapses without them. Healthcare is no different. BIT treats medical care as a collective asset, not an individual luxury. 2. Community-owned, not investor-owned. Most of America's healthcare crisis can be traced back to one fact. 70% of U.S. hospitals, clinics, nursing homes, and urgent care chains are owned by private equity firms, hedge funds, or massive corporate conglomerates. These entities have one legal obligation: maximize returns. BIT flips that. Under BIT, the healthcare system is collectively owned by members, operated as a cooperative, and governed democratically, not by investors looking for quarterly gains. No one makes money by denying you care. No one profits because you got sick. No one is incentivized to push you into a high-deductible plan. The community owns the system, so profits are reinvested back into the community, lowering costs, expanding services, hiring more providers, and improving care. 3. Pooled power beats individual vulnerability. Right now, families are negotiating with trillion-dollar insurance companies as isolated individuals. That's not a fair fight. That's economic slaughter. BIT uses collective membership to pool risk and bargaining power. Bulk purchasing of prescriptions. Direct contracts with physicians. Cooperative clinics. Negotiated specialist networks. on-site preventive care hubs, subsidized mental health and reproductive care. When 10,000 families negotiate together, prices drop. When 100,000 negotiate together, middlemen disappear. When 1 million negotiate together, you have a parallel healthcare system. And unlike the ACA marketplace, where subsidies can vanish with a political mood swing, BIT's healthcare fund is member-owned and member-controlled. No Congress can take it away. 4. BIT eliminates the catastrophic choice altogether. The mother choosing between her retirement and her kid's education? Under BIT, that choice never appears. Here's why. Premiums are income-adjusted and collectively subsidized. Deductibles are dramatically lower, or eliminated entirely. Preventive care is guaranteed. Catastrophic costs are absorbed by the collective fund. Care decisions are made by doctors and patients, not utilization managers. When a community owns its healthcare system, there is no financial incentive to delay treatment, deny procedures, or ration care. The incentive is the opposite. Keep people healthy, stable, and economically secure. BIT restores what the current system stole. Health, stability, and dignity ****. The American healthcare system manufactures insecurity because insecurity is profitable. A population terrified of medical bills is a population that works longer hours, accepts lower wages, stays tied to employers, and accumulates debt that extracts wealth for decades. BIT breaks that relationship entirely. Instead of treating sickness as a revenue stream, BIT treats health as an asset that belongs to all of us. Instead of forcing people to choose between their future and their survival, BIT guarantees that neither is sacrificed. If the current system profits from Black suffering, BIT profits from Black wellness. This is more than a healthcare model. It is a blueprint for liberation, stability, and collective power.